Hi everyone. My presentation today focuses on a literature review of the impact of maternal positioning during the second stage of labor. I will be specifically comparing two very different positions, which are the lithotomy position and the upright squatting position. So why exactly did I choose obstetrics? Basically, it is a highly specialized field of medicine. It mainly focuses on the care of pregnant patients, it focuses on newborns, and it focuses on every process that leads to and includes the postpartum period. It requires each and every patient to obtain comprehensive management from the point of conception to delivery and then the postpartum period. And a crucial factor that I'd like to focus on is the positioning of the patient within the second stage of labor. This is the delivery stage, the childbirth stage, and it's important to review this because positioning can have a crucial impact on maternal response and outcomes. In this review, I'm going to be exploring how two very diverse positions, including the lithotomy position, which is the most commonly used position where the patient is laying flat on their back, as well as the upright position, which is a more non-conventional position where the patient's giving birth in more of like a squatting position, where the patient's body is more vertical, and how these have an impact on maternal pain and the duration of the second stage of labor. My main interest in this topic, it stems from my personal experience as a labor and delivery nurse. I've observed very different positions being utilized within the second stage of labor, use of both the upright and lithotomy positions, and in my personal experience, it's given me a desire to explore how these alternative positions might improve maternal outcomes. All of that being said, how can non-conventional positions such as upright squatting affect maternal pain, length of labor, and overall birth experience? And can the evidence-based clinical guidelines be optimized to improve these outcomes? Now, to guide this review, I formulated the following PICO question. In delivering pregnant patients, how does the lithotomy position compared to the upright squatting position affect maternal pain and the length of time in the second stage of labor during the process of childbirth? Presented in this slide, I briefly reviewed the literature search strategy that I used. My preferred databases were PubMed, NCBI, and Elsevier ScienceDirect. I've created a table that includes keywords, synonyms, subject heading, and the number of PubMed-specific results in relation to the population intervention comparison outcome and time within my PICO question. As stated on this slide as well, you can see that the limitations that I used were specific to the date within the last 10 years, clinical trial, randomized control trial, English language, humans, and female. Let's start with the first article by Satonen Teade in 2023. Throughout this study, the authors review non-conventional alternative birthing positions that are in comparison to the lithotomy position within the second stage of labor. The key findings that I've discovered are that the traditional lithotomy position can present some significant challenges. It's discovered that in this position, patients tend to experience more discomfort, have less effective contractions, and more abnormal fetal heart rate patterns. Fetal descent is also challenged in this position, which can delay the pushing phase of labor and possibly increase the need for medical interventions, such as those to assist in the delivery of the fetus. On the other hand, the upright squatting position was found to increase maternal satisfaction and create a greater autonomy for the patient during labor. In addition to this, it was discovered that upright positions tend to shorten the second stage of labor and decrease maternal perception of pain, which directly relates to my presented PICO question. The use of gravity in the upright position can also assist with fetal descent, and it allows for a wider pelvic outlet, which can additionally reduce complications. The second article I reviewed by Schulten and many others, written in 2024, focuses on the positive impact that the patient's choice of birthing position has on maternal satisfaction and autonomy. Within this study, the authors discovered that patients who experienced more autonomy in choosing their position during labor were more likely to express those higher levels of satisfaction. One important thing to note that was discussed as a key finding in this article is the impact that medical staff have on the patient's choice of position. These personnel play a key role here by offering education and guidance on the benefits and risks of different positions in labor. Another key finding to note, which I found to be quite interesting, was that women with a higher level of education were more likely to choose the upright position during labor. Now, the findings that were presented in this article suggest that maternal autonomy in position choice, specifically the upright position, correlates to better subjective experiences, which can impact maternal outcomes. Such outcomes include reduced pain and fewer interventions. And in contrast, the lithotomy position tends to lead to decreased rate of maternal satisfaction and higher levels of maternal discomfort. Moving on, I'd like to discuss a systematic review written by Gupta and many others in 2017, which compared the lithotomy position to upright positions in the second stage of labor. Their findings uncovered that the use of the upright positions during childbirth significantly reduced the duration of the second stage of labor, and it was also associated with fewer assisted deliveries, episiotomies, and incidences of abnormal fetal heart rates. However, this review also did discover that upright positions were unfortunately associated with higher blood loss volume and a potential for an increased risk of second-degree perineal tears. But in comparing the lithotomy and the upright positions, there was found to be no clear difference in the rate of cesarean sections, the amount of third and fourth degree tears, and the rate of NICU admissions for the newborn. Despite all of these factors, the overall evidence presented in this article suggests that upright positions are preferable in terms to shorter labor, less pain, and compared to the lithotomy position. And these factors are particularly relevant to my PICO question. I'd next like to review an article written in 2019 by Huang and many others that examined different maternal positions in the second stage of labor and their importance in relation to childbirth. This study found that upright or squatting positions not only led to fewer perineal tears, but also resulted in a shorter second stage of labor and less maternal pain. Meanwhile, the lithotomy position was found to contain more complications. These include an increase in incidence of obstetric anal sphincter injury and more instances of fetal heart rate abnormalities. This position was also found to increase perineal trauma, increase blood loss, and amplify pain, as well as extend the duration of the second stage of labor. And in relation to my PICO question, the findings of this article support the notion that upright positions tend to be more beneficial when utilized during childbirth. The final article that I reviewed was written in 2023, and the authors focused on the birthing experience of Chinese women who delivered in an upright position. Their findings indicate that the upright position facilitated the patient's participation and decision-making throughout their childbirth experience, and additionally, patients who utilized this same position reported better coping abilities, decreased pain, and less anxiety. These same patients were seen to feel more empowered, which led to a lower incidence of negative emotions and also less labor pain. On the contrary, patients who maintained the lithotomy position tended to feel less engaged in their birthing process. And in relation to my PICO question, it discovered that patients in the lithotomy position, in comparison to the upright position, experienced less maternal satisfaction. Now, the emotional and physiological benefits of adopting the upright position can positively impact the patient's experience, and a positive birthing experience can have a massive impact when evaluating a patient's perception of pain. As for recommendations for clinical practice, in my opinion, there is much to be taken away from this research. Below, I've discovered a few recommendations that can be implemented in clinical practice in order to improve patient outcomes, and such recommendations include empowering patients, encouraging maternal autonomy, and clinicians can do this by offering education on alternative birthing positions earlier in the pregnancy and throughout the prenatal period, for example, when patients come in for prenatal appointments. This information can give patients the knowledge they need to make informed decisions about their choice of birthing positions. The second recommendation includes the incorporation of upright positions in practice by creating guidelines that prioritize these upright and squatting positions, especially for women who choose to experience a natural childbirth, and this typically involves a patient delivering without any anesthesia, such as an epidural. My next recommendation specifically focuses on enhancing pain management and coping mechanisms, utilizing what was uncovered from this literature review, specifically the benefits of the upright position in the second stage of labor. We as clinicians can utilize our knowledge and skill to encourage the use of such positions, thus minimizing discomfort and decreasing the time spent in the second stage of labor. Now, this leads to my final recommendation for clinical practice. I feel a significant improvement can be made to clinical guidelines by providing more training to healthcare professionals regarding both the risks and benefits associated with different birthing positions. Personally, I feel it's essential to ensure that healthcare professionals are properly trained to assist patients in adopting those non-lithotomy positions and making sure that they are comfortable with these techniques. Without this skill, we are unable to effectively communicate important educational information to our patients, which can have a significant impact on their birthing experience. In conclusion to my presentation, I feel maternal positioning during the second stage of labor significantly affects various aspects of the childbirth experience. As I've discovered in a literature review, patients who adopt the upright or squatting positions during childbirth have reported decreased pain, shortened second stage of labor, and a greater sense of fulfillment within their birthing experience. However, the lithotomy position has often been linked to increased discomfort, a longer period of time spent in labor, and an increased likelihood of the need for medical interventions. I truly feel that the key takeaway from this research is the importance of education and training for both the healthcare providers as well as the patients. And by providing the patients with education and empowering them to choose their preferred positions during childbirth, us as healthcare providers can improve both maternal health outcomes and the overall birth experience. Lastly, here are the references that I used throughout my presentation. I appreciate your time. Thanks for listening.